a briefing on the Opioid Restitution Fund. We are joined by the Health and Social Services Subcommittee of Appropriations, the Public Health and Minority Disparities Subcommittee of Health and Government Operations, along with my co-chair, Delegate Jocelyn Pena-Melnick, who chairs that subcommittee. And then we are also joined by a number of other legislators, both from Appropriations and HGO, and just folks who are otherwise interested on this call to go over the any information and status that we have on the Opioid Restitution Fund. Just as a brief reminder, this was a bill we passed, I believe, 2 sessions ago. Delegate Rosenberg, you were the sponsor. You can remind us, in anticipation of potential settlement with various pharmaceutical companies with regard to the opioid litigation that has been going on, in an effort to try and avoid some of the pitfalls and mistakes we made with the cigarette restitution fund that occurred back in the day. So we thank Delegate Rosenberg for being having forethought on this process, and we will go ahead and kick it off with a panel of the Attorney General's office, the Attorney General himself, Brian Frosch, and then he is joined by Deputy Attorney General Carolyn Kudracki, Chief of Consumer Protection, William Grunn, and another Assistant Attorney General, Brian Edmonds. So, Mr. Attorney General, the floor is yours. Please kick it off.
Well, first of all, Mr. Chairman and Madam Chair, thank you very much for this opportunity. We really appreciate it. And my folks will be here just to correct me when I screw up. But I'm gonna try to get through it all by myself. We'll see how it goes. I want to second your congratulations of Delegate Rosenberg, who has overcome a shady legal education to become a far-seeing, effective, and right-thinking legislator. And I knock his alma mater because I share it. So I want to give you an update. Oops, I thought I was going to be able to share my screen, but it's not quite allowing me to do that.
I can share the presentation for you, Attorney General.
Okay. Yeah. There you go. So first, I want to put this in context. What I'm going to talk about mostly is a settlement that we've lumped together with the 3 main distributors, McKesson, AmerisourceBergen, and Cardinal Health, along with Johnson & Johnson. It's a very large settlement. It's $26 billion in total. But just for context, you should know that we have actions pending against several other opioid manufacturers, distributors, et cetera. The most noteworthy of which is the Purdue and Sackler family matter. Purdue went into bankruptcy. The Sacklers went into bankruptcy, said, we'll contribute money, but we want bankruptcy immunity. They offered to contribute $4.375 billion. Most of the states accepted that, along with 8 other attorneys general. I thought it was because they had taken about $10 billion out of the company in the years just preceding the bankruptcy of the company. I thought, and so did a number of other AGs, that it was inappropriate for them to be able to walk away with only that contribution. We recently won that case in the district court in New York, federal district court in New York. It will be appealed, it's still pending, but there is maybe $6 billion total on the table right now. And Purdue was probably the worst actor in this space during the term of the opioid crisis. So it puts in perspective, the fact that we're getting $26 billion from 4 other players, maybe 6 from Purdue and the Sacklers, maybe a little more. There was a nationwide $500 million settlement with McKinsey and Company that brought Maryland about $12 million, I believe. And as I say, there are other investigations and actions pending against a variety of other participants in the opioid industry. But this settlement is likely to give us and everybody else in the country our biggest help for the opioid crisis that still plagues our state. So if you could move to the next slide, let me begin to describe it. So I think I've already said this. The only $26 billion in total. The distributor portion of the settlement will be paid out over 18 years. The Johnson & Johnson portion will be paid out over 9 years. Next slide. So we will get approximately $401 million from the distributors. We'll get $91 million from Johnson & Johnson over 9 years. Those are our maximums. Our total would be $492 million. But we'll get a significant portion up front. We get about 2.11% of the national abatement amount. Our population was 1.88. We do a little better because we had a little more opioid intensity than your average state. And the distribution formula is based on population, but 3/4 of it is based on opioid intensity. Pursuant to Delegate Rosenberg's bill, and also pursuant to the settlement agreement itself, 85% of this money must be used for future opioid remediation. And it requires, in order to achieve our maximum amount, it requires full subdivision participation, all the counties, all the municipalities. Attorneys' fees are coming out of a separate pot. $2 billion of the $26 billion has been set aside for attorneys' fees, although there may be situations in which some local governments have made arrangements with their private counsel, in which case they will receive money out of those subdivisions' shares. Next slide, please. Thanks. So the $492 million is dependent upon our getting full participation. And we're going to get $266 million for the state being in the deal. That's about 54%. But we can also get another $226 million in incentive payments. If you could move to the next slide. There are 4 different ways in which the state can, quote, earn its incentives. Incentive A, the first one is if you guys pass a law and say, okay, this is it, where the subdivisions are out, can't bring their own cases, the state is going to bar that and take the money and distribute it. Or if a court makes that kind of a decision, then we get 95% of our allocation right up front. Or we go to incentive B, and I'll show you the sliding scale in a moment, but it means we have to get participation by the vast majority of the litigating subdivisions in order to get Exhibit B, which I believe is 20% of the total settlement. Incentive C is very similar. I think we have to, we start getting money at 65% participation, and these are for litigating and non-litigating subdivisions. And incentive D, which is 5%, we earn if after this settlement, there are no cases filed in the future that survive motions to dismiss. Next slide, please, June. So here's what bonus B looks like. If we get 84% of our subdivisions by population participating, we get zip. 0 of the 20%. If we get 85%, we get 30%. So you can see it's a very punishing schedule. We have to get the vast majority in order to start making bonus B. We, at 86%, we get 40%, and it works its way up to 100% for us to get 100% of our allocation of the 20% that is bonus B. And next slide, please. Bonus C works in a very similar fashion, except it starts at 60%. Below 60%, we get zip out of the 15% that makes up bonus C. And, we have to get all the way to 100 to get 100. But you see, even if we get 95%, we only get 90% of bonus C. 93%, we're down to 65%. So these are really steep challenges. Next slide, please. So last Friday, we've negotiated this a memorandum of understanding with the counties and cities, and they've begun to come in and say, okay, we're in. We think we've got about 50% so far. I'm not sure what happened today, but we've gotten forms signed by 16 counties and 4 cities, and that's where we are today. By January 26th, I believe it is, that's the cutoff. We got to get as close to 100% as we possibly can. Next slide, please. So if we get 85 to 90% of our population participating, instead of the nearly 500 million, the 492 million, we'll get somewhere between 379 and 395 million dollars. If we only hit 90%, we'll lose $97 million. If we only hit 85%, we'll lose another $16 million. Next slide, please. The settlement agreements provide a default allocation between the states and their subdivisions that work out to be 50-50. Each state has, done modifications of that. We have changed that around. Roughly, it's going to be, I believe it's going to be like a 60-40 split. The counties and cities will get money through a grant program. They'll get some directly, and then they will get more through a grant program run by the Department of Health. We will need legislation from the General Assembly to codify that memorandum of understanding, put it in law for the next 18 years. Next slide, please. As I said, the state will receive about 30% for direct spending under the Rosenberg bill. We'll get another 45% that we must grant to subdivisions. We've put together a formula similar to the state allocation formula. It's 25% population and 3 different measures, each 25% each, of opioid intensity, the number of deaths, the amount of opioids consumed, et cetera. The subdivisions will receive 25% directly. They may use up to 15% to compensate for past abatement programs. The balance of their total share, which is, I guess 70% of the overall settlement, must be used on future opioid abatement. I mean, the point is, we don't want this money, and neither the national settlement requires and the Rosenberg bill require. We don't want this money to be used to fill potholes. We don't want it to be used to build jails or to pay back subdivisions a whole lot for the expenses that they incurred as a result of the wrongdoing of the folks that are participating in this settlement. Next slide, please. We want it to be used to help people who are suffering from opioid addiction, folks who've lost breadwinners and who are in dire straits as a result of the opioid epidemic. Both settlements include injunctive relief. For the distributors, there are going to be monitoring and reporting of distribution to prevent suspicious orders and other means of diverting the opioids that they are distributing. And that's why they're in this in the first place, because we found that they were filling orders all over the country where, and it was just as true in Maryland in some pockets where they're distributing more opioids than there were people, more prescriptions than there were people in those jurisdictions, and should have been caught a lot earlier. Johnson & Johnson will stop selling opioids altogether under the terms of this agreement. Next slide, please. Is that it? Are we done?
That is the end of the presentation.
Okay. So that's the deal on the settlements with these four entities. Mr. Chairman, I'd be pleased to answer questions, entertain criticism, insults, whatever else you got.
I guess when you have announced that you're not running again, you can entertain those without much worry, right?
They still hurt. They still move me.
We will recognize Delegate Kaiser, who had her hand up.
Thank you, Mr. Chairman. And thank you, Mr. Attorney General. I just want to go back. I don't remember if you mentioned it was the B or C funds where we've had 50% of the population from the counties agreeing now, and that you're still waiting to hear from some others. Has any jurisdiction said no?
Nobody has said absolutely no, but as things stand now, we're pretty sure we're going to miss a big jurisdiction.
Thank you.
Thank you. Move on to.
And what happens there is they're free to pursue their own lawsuit. And that's, they're making calculations to whether or not that's to their best interest or not.
We'll recognize Delegate Rosenberg.
Delegate, I think you're muted.
You're on mute.
Thank you. Thank you, Mr. Chairman. Thank you, Mr. Attorney General, for your kind words about me and your not so kind words about our alma mater. That's fine. This bill is modeled on as Chairman Resnick said, the bill that we passed for the cigarette settlement. The flaw in that bill is that we allowed money to go to Medicaid generally and not specifically to address the problems resulting from cigarettes. So that's why the bill as it is more specific. One question for the Attorney General is January 26th, they dropped dead, as we say in Annapolis, deadline. There's nothing that can be done if this one jurisdiction is not in and involved by the 26th. There's no pressure to be put on them, shall we say.
No, I think that's right. I mean, look, if they turned around and said on February 26th, you know what, we changed our mind, we'd like to join, we might be able to get, we might be able to go to the distributors, Johnson & Johnson, say, okay, look, they're willing to drop their lawsuit, they're willing to join, how about letting them into the fold? But January 26th is the drop dead date. The way things stand right now, if they're out, they're out. If they're in, they're in. But it's a big risk. It'll cost everybody something if they're not in, them most of all. But the drop dead date was January 2nd, and the companies extended it to January 26th.
And could you say again, what does the bill that you've drafted do?
It codifies the memorandum of understanding that I was describing. So I mean, look, in Maryland, the state paid about 80%, 76%, I think, of costs of opioid abatement, remediation services, et cetera. But we have to get the participation of the counties and municipalities in order to maximize our share. And so we, like just about every other state, made concessions to entice our subdivisions to join the settlement.
Thank you. Thank you, Mr. Chairman.
Thank you. Let's move on to Delegate Valentina Smith.
Thank you, Mr. Chairman. Thank you, Attorney General Fosh, and to Delegate Rosenberg. Thank you for your work on this, and really want to extend the sorrow for the loss of your mother, and know that she's the one that's part of your impetus for always wanting to protect the good citizens of Maryland.
Thank you.
So I may be missing something here. I have a question on it. Then incentive A is too late. In other words, if you were to try to say to the parties that should we pass a piece of legislation, which is incentive A, that then we could avail ourselves of the higher allotment to the state.
I mean, that option is still available. I think it has to happen within a certain period of time, and I can't remember the time frame. But you guys could go into session. You could say, okay, the rest of you guys are out of court. The counties and cities are out of court. That's it. The state's just diving in, and we'll cut up the additional money with you.
So I guess usually there's some like higher level discussion on this that I may not be privy to, but has the decision or the discussions been had that incentive A is something that we should draft and go forward with? Or?
We haven't done that. And I mean, you're talking about something that would be extremely politically divisive. I mean, first of all, our job was to get as many of them on board as we possibly could. At least that's how we viewed it. Instead of rolling the dice and saying, okay, we're going to hand it to the General Assembly and see if they can get, bonus A, crush everybody else's causes of action and just say, we'll take it from here. So, we viewed it as our job to put together as big a coalition of subdivisions as we could in order to maximize our state recovery under the options B, C, and D scenario.
So just, Mr. Chairman, just so that I understand that, we're always all in a bipartisan way trying to do what's best for the state, which would be to get the maximum amount of resources that we can. And so I may not be seeing the nuances here, but it seems that incentive A ensures to a greater likelihood that the state will capture the maximum amount of resources and then follow Delegate Rosenberg's theory that it be fairly and authentically spread out to address the opioid issue. But I guess at a higher level then, Mr. Chair, we have to leave it at the drafting deadlines tomorrow on whether or not incentive A is drafted or not. But thank you for helping me understand that.
Yeah, let me say this also. Pursuing option A, which might redound to the state's best interest. I don't have an opinion on that. I guess it would. We get more money if we had option A, but it's a huge political lift. Number one, it will be extraordinarily controversial. Number two, and number three, there may be constitutional issues about whether the state can extinguish the claims of its subdivisions. So, if we get all the subdivisions on board, then it may make sense to go ahead and pass a law, or if we get all but one and you want to go after the 1 or the 3 or the 5 or the 10, and say, look, if you guys are in, we're going to make a lot more money. We're just going to do it. If you made that kind of policy decision, you could do it, and our fallback would be, well, we've got, we're getting 85% or 90% of the money. Now we might as well get the whole shebang if we can. But I gotta say, there's so many rabbit holes and twists and turns that would ensue from that it would just it'd be very difficult.
Thank you. And then just in closing, it does say other states have done it. Just let us know how many, but I imagine that this decision is at greater levels right now. But thank you for helping us understand.
My pleasure. Thank you.
Thank you. Before we go on to the next question, Mr. Attorney General, if you can, I don't know if I just missed this, but if you can clarify what a subdivision is it a county?
I'm sorry.
Or
Yes,
or is it a
subdivisions,
state?
counties, and municipalities.
Okay, so you would need all the counties and municipalities and states, all that are involved in the lawsuit, to all agree,
Yeah.
or whatever percentage.
Yes.
Let's move on to Delegate Hill.
Thank you, Mr. Chairman. Thank you, Mr. Attorney General. So can you tell me just two things? What are the total number of subdivisions? And where does the money go if whatever falls short of our 100%?
Yeah.
Where does that go?
Yeah, great questions, Delegate Hill. Okay, there are 24 counties, including Baltimore City, right? Then there are hundreds of municipalities. And maybe I'm shooting too high. Maybe there aren't hundreds, but there are many municipalities. I live in an incorporated municipality, the town of Somerset, right? It's got 400 homes in it, 1,000 people. Now it's not a litigating subdivision, but you've got lots of little places around the state like that. And it's not just Rockville or Gaithersburg or Hagerstown or Easton. I'm sorry, Easton may not be Cambridge.
Delegate Johnson said 157 municipalities plus the 20.
Right?
Does that sound right to you?
Yeah, that sounds reasonable.
So we're talking about 180 some.
Yes.
181 or something like that.
Correct.
And do you know how many are litigating? Because one of the options was litigating and non-litigating, and one was just the ones that are litigating. Did you?
I think 22 of the 24 counties were litigating. And I want to say it's something like 30 or 40 municipalities.
Okay. So it sounds like you were just explaining to Delegate Valentino Smith why A is a hard lift. It sounds like B and C are ridiculously hard lifts too for us to get anything substantial. Yeah. Is that my understanding?
Very hard.
Okay, thank you.
Okay, Delegate Johnson.
Thank you, Mr. Chairman, and thank you, Mr. Attorney General. What kind of campaign has been put out to the subdivisions?
So we've been communicating with subdivisions as this settlement has taken shape. And, I've spoken to MACO and MML on a number of different occasions before we knew the final outlines, before we knew exactly how the settlements were going to be structured or how much the total amount of the money was. Since we learned that, which I think probably in August or July, we've had a series of meetings with MACO, MML. We asked them to put together a negotiating committee because, frankly, some of the subdivisions believe that they should be getting all of this, straight to them. And they have, they had many interests that they wanted protected, and they preferred to have the money direct instead of through grants by the Department of Health. And frankly, the grants are just a way of ensuring that any subdivision that is going to be receiving money has a plan on how they're going to spend it. It tells the state what they're going to do with it. And the state is not so much going to be saying we don't like your plan, as long as it qualifies. The Rosenberg bill has, I think, 16 or 19 different uses that you can put the opioid abatement money to. The state settlement plan has a similar list. So we don't anticipate that there will be a lot of red tape, but we just want there to be a structure that ensures that the money is spent on the things that the law and the settlement agreement with the distributors and J&J require.
Thank you. Thank you, Mr. Chairman.
Pleasure.
Thank you. Are there any other questions? I'm seeing none. So with that, Mr. Attorney General, Delegate Hill wants a second bite at the apple. Go ahead, Delegate Hill.
Thank you, Mr. Chair. I apologize. I put it in the chat. I'm just wondering, Mr. Attorney General, can this group get a list of the subdivisions, the ones who've responded yes, and the ones?
I'm having trouble hearing you, Delegate.
Okay, is this any better? No?
No,
Better?
no.
Okay. Maybe we can look in the chat. Look in the chat.
Yep.
There's the question. Can we get a list of the ones who have not responded and the ones you're anticipating may not come aboard? I mean, it may be helpful to us and to your goals. Or is that out of?
Yeah, I think we can do that. I think we can give you who we've got. And but we expect another 30-40% to be, we hope at least another 30%, and we hope 40 to 42 or 3% will be participating by January 26th. But I think we can send you a list of who's in.
Right, and the ones who aren't litigating, and to the earlier question, where does the money go if we don't get it? Who gets it?
Okay, so some of it goes directly to the municipalities and counties. Some of it goes directly to the state. And then there's an opioid abatement fund that is set up from which the state Department of Health will make grants to the counties and cities.
Let me interrupt for a second. I'm sorry. Sure. I was asking the money we don't get. We're allotted up to 100%. So the 10, 30, 40% we don't get, where does that go?
Back to the defendants, back to the distributors, back to Johnson & Johnson. Because they're figuring, if the county of Jabip doesn't join, but continues their suit, we're going to have to settle with them or go to trial. And if we lose, we're going to need the money to pay them off.
Thank you.
Okay, back to Delegate Rosenberg.
Thank you. Can we assume, Mr. Attorney General, that no subdivision has legislation like our restitution fund that would mandate that the money they get, especially if they're not participating in the suit, would be spent for uses that address the problems caused by opioids?
I mean, it's possible, Delegate, that some subdivision has a similar provision. I don't know of one, though.
Thank you.
All right. Seeing no other questions at this point, thank you, Mr. Attorney General, and your team for being on with us.
Thank you, Mr. Chairman.
Are obviously welcome to join us for the second half of this briefing. That's at your discretion. I'm going to go ahead and turn it over to Delegate Jocelyn Pena-Melnick to chair the second half of the briefing.
Thank you, Mr. Chairman, and good afternoon, everyone. It's great to see you, Brian. I consider you a friend. I know, Mr. Attorney General, and you certainly will be missed. So the second portion is actually, we're going to hear from the Office of the Opioid Operational Command Center. And we have the Executive Director, Ms. Rickard. We have also the Deputy Director, Marianne Gibson, and the Grants Coordinator, and I hope I pronounced your name correctly, Khalil Coutier. And welcome. Will you please get started?
Thank you
I
very
see
much.
Ms. Ricker.
There are slides. Okay, good afternoon, Madam Chair Pena-Melnick, Chair Resnick, respected members of the subcommittees present. Thank you for this invitation to speak with you today, and also thank you to Mr. Attorney General for your presentation. My name is Robin Ricard. I'm the Executive Director of the Opioid Operational Command Center, and it's an honor to appear before you to discuss our office's approach to utilizing the Opioid Restitution Fund, or the ORF, and also to discuss with you the work that the Opioid Operational Command Center is doing to ensure that all funds that Maryland receives, and we hope that we do get everyone on board as a result of the prescription and opioid litigation, will be used effectively, equitably, and with a high degree of transparency. In short, Maryland is very well prepared to put forth any litigation funds that the state receives to work right away. Through the strategic framework outlined in Maryland's Interagency Opioid Coordination Plan, which our office updates every year, combined with the OOCC's established grant-making procedures, we will ensure that these funds will do the most good for the most individuals and communities suffering from the harms of the opioid crisis. This work is very important, especially now that the overdose fatalities have reached historic levels in our state and across the country in the wake of the coronavirus pandemic. Next slide. Governor Hogan tasked the OOCC with formulating the state's plan to administer the ORF funding, which the administration is required to do under the legislation and established the fund. As Maryland's primary interagency coordinating body for the state's efforts to address the opioid crisis, the OOCC is responsible for maintaining and updating the state's interagency opioid coordination plan, which guides the state's response strategy. The OOCC, for those of you who are not familiar, was created in 2017 after Governor Hogan declared a state of emergency in response to the rapidly increasing number of opioid-related overdoses. The executive order that established the OOCC outlines our mandate, which is to prepare the Interagency Opioid Coordination Plan, which we'll hear a lot about, which is the strategic framework underpinning the efforts of all state agencies addressing opioid mortality, to coordinate the opioid crisis response efforts and of all state agencies and Maryland's local jurisdictions, and to identify gaps in local resources and to disseminate resources and best practices to fill those gaps. In creating the OOCC, the governor laid out three major pillars to guide our work. Those are prevention and education, enforcement and public safety, and treatment and recovery. Prevention and education programs include efforts such as harm reduction initiatives, information campaigns, and school programs. Enforcement and public safety related programs include drug interdiction efforts, as well as jail-based treatment programs and alternatives to incarceration. And treatment and recovery programs include crisis services, peer programs, and outpatient residential treatment services. We also work with the opioid intervention teams in each of Maryland's 24 local jurisdictions, and OITs, or opioid intervention teams, are multi-agency coordinating bodies that seek to enhance collaboration at the local level. They're chaired by the health officer, the emergency manager, and usually have representations from various local agencies as well as community organizations. And lastly, another area of our work involves grant making to support high priority initiatives that advance the governor's policy priorities. The OOCC right now currently administers two distinct grant programs, the Block grant program and our competitive program. The Block program distributes funds directly to each of Maryland's 24 jurisdictions, local jurisdictions via their OITs, using a formula that considers local overdose rates. We also have our competitive grants program, which is designed to distribute funding to the highest scoring proposals that we receive from state and local governments and from private community-based organizations. Next slide. The Interagency Coordination Plan is the state's foundational document that outlines goals, strategies, and tactics to advance the 3 policy priorities. Every year, the OOCC works with our state and local partners, as well as representatives from private community-based organizations, to review and update the plan based on the evolving needs and priorities around the state. This year's coordination plan will incorporate several new elements that will help make it even more comprehensive. New considerations in our plan for 2022 will include the findings from the Data-Informed Overdose Risk Mitigation Initiative, or the DORM, which was initiated based on the passage of Chapter 211 Act of 2018. The goal of DORM is to link data from overdose decedents across the various public health and public safety sources. Linking these data sets enables us to identify common overdose risk factors, which in turn can help us direct resources to the most critical areas and to better calibrate programs and policies that can help reduce overdose and mortality. The plan will also incorporate community feedback collected from our ongoing Maryland Stop Overdose Strategy Regional Town Hall series. Maryland SOS is a multi-pronged campaign that leverages new and existing funding sources and partnerships to address the rise in overdose deaths observed during the COVID-19 pandemic. A central component of the campaign involves our Town Hall series, through which we're gathering feedback directly from community members across the state. The town halls offer individuals and communities a forum to talk about what's needed to address their community's specific needs. And this in turn will again help us better tailor our response efforts to consider those needs, which might not be the same for every region of the state. And also the plan will take into account the goals of the statewide integrated health improvement strategy, or SIHIS. SIHIS seeks to align statewide efforts across the 3 domains with the goal of improving outcomes for Marylanders, and reducing opioid-related mortality was identified as one of the state's priorities under this initiative. And lastly, the coordination plan will consider the work of the Maryland Racial Disparities in Overdose Task Force. The task force is currently working under the Interagency Heroin and Opioid Coordination Council to address the increasingly disproportionate impacts of the opioid crisis on Maryland's Black communities, which have accelerated in recent years. Next slide. And this slide just illustrates some of our processes for updating the coordination plan. Taken together, these considerations ensure that Maryland's opioid crisis response efforts are very thorough and comprehensive. Next slide. In addition to the interagency coordination plan, the OOC's existing grant-making infrastructure will ensure that the ORF funding is put to work without delay. The OOCC's grant procedures were developed by surveying and adapting the best practices from all state-level grant-making entities in Maryland, and they've been reviewed and refined extensively to optimize the process for evaluating proposals fairly and transparently. Next slide. The OOCC's competitive grant program embodies a good example of our grant procedures. Our competitive proposals are scored based on a uniform set of criteria, including the degree to which they align with the interagency opioid coordination plan and how they meet the most pressing needs around the state. Each grant application is reviewed by a scoring committee consisting of OOCC staff and subject matter experts from various state agencies and non-governmental partners. The scoring committee then makes a recommendation to the executive director on applications that have scored the highest. The OOCC also has strong procedures in place for post-grant management. We continually review each agreement to ensure optimal grant performance and to verify that our grantees are meeting their goals. We have great relationships with all our grantees. These procedures are outlined in our grants manual, a document that we continually refine to ensure transparent and efficient use of any funds that we received. Next slide. And taken together, we're confident that Maryland's existing strategic opioid crisis response framework, as detailed in the interagency opioid coordination plan, combined with our grant-making procedures, will enable our office to meet the requirements for distributing funds through the Opioid Restitution Fund. And as you know, the ORF was established following legislation that was passed in 2019 to manage all the money that Maryland receives from prescription opioid-related settlements. We were very proactive in establishing this important legislation to ensure that prescription opioid funds are used to directly reduce the harms of the opioid crisis. It outlines various requirements that ensure that any money we receive is used to support proven strategies and programs that can reduce opioid mortality. Additionally, it makes sure that our leaders work together to use the funding in ways that work for everyone in the state. It requires the governor to create a plan to use the settlement funds with specific goals and performance indicators. The governor must also submit a report annually to the General Assembly detailing progress toward achieving those goals. And lastly, it requires the governor to consult annually with key stakeholders, such as experts in the fields related to substance use disorder, members of the treatment and prevention communities, community members who have been affected by the opioid crisis. Next slide. And as I mentioned, ORF may be used to support a select variety of priority areas, which are outlined in the enacted legislation. These include critical priorities such as treatment and recovery, peer programs, screening, brief intervention, and referral to treatment or SBIRT, increasing access to medications used to treat opioid use disorder, such as buprenorphine and methadone, Maryland's heroin coordinator program, mobile crisis services, and school education campaigns. Each of these areas are also represent a key components actually of the interagency opioid coordination plan. And as such, the OOCC is already supporting a wide variety of initiatives that are in line with the goals of the opioid restitution fund. And next slide. To date, as already discussed, Maryland has received about $10 million in prescription opioid settlement funds. These funds represent the first disbursement in a $12 million settlement from McKinsey and Company, following the firm's role in developing dangerous prescription opioid marketing strategies. And I would just like to note that these funds received through the McKinsey settlement are separate from the larger settlement that the Attorney General just outlined and are less restricted in the way they can be distributed. Later this month, the OOCC will begin utilizing these funds through a grant program designed to support the implementation of the Opioid Use Disorder Examination and Treatment Act, which was enacted through legislation introduced by former Delegate Eric Barron and was co-sponsored by Delegate Pena Melnick. This important legislation, which passed in 2019, requires that by January 1st of 2023, all local detention centers and the Baltimore City pretrial unit booking facility have programming in place to screen individuals who are incarcerated for opioid use disorder and to make available one formulation of each FDA-approved full agonist, partial opioid agonist, and long-acting opioid antagonist used for the treatment of opioid use disorder if clinically appropriate. Through this grant program, we will support local health departments and detention centers to expand access to opioid use disorder related programs as required by that legislation, such as peer recovery services, medications for opioid use disorder, such as methadone and buprenorphine, care coordination services for individuals exiting incarceration. This program is very vitally important because justice involved individuals with substance use disorder are among a very high risk or at a high risk for overdose. Additionally, the OOCC plans to leverage the remaining $2 million from the McKinsey settlement to continue expanding capacity and the infrastructure to complete the data linkages, management, and analysis to support the DORM initiative, or that is the Chapter 211 Act of 2018, which I previously discussed. Next slide. So collectively, we are confident that the OOCC's established grant-making procedures and Maryland's strategic framework will provide a seamless mechanism to administer prescription opioid settlement funds to areas with the greatest need. We're already putting this money to work to help some of the most vulnerable individuals with substance use disorder using the thoughtful framework outlined by the ORF. The funds that Maryland receives from future settlements will do a tremendous amount of good for redressing the harms of the opioid crisis. And the OOCC is committed to managing the programs with the highest degree of transparency as we move forward. And with that, thank you very, very much for your time, and I'll be happy to answer any questions.
Thank you so much, Ms. Ricker, for your presentation. At this time, I would like to open it up for questions. I'm looking to see if I see any small hands. Are there any questions for Ms. Ricker? Delegate Valentino Smith.
Thank you, Madam Chair.
My pleasure.
Thank you for the presentation. I just will self-disclose that I have a lot of the years of frustration with the discussion of competitive granting programs. Use them a lot, and in my impression, sometimes they tend to not be as equitable as possible because some jurisdictions don't have as robust of an ability to have grant writers and the ability to fill out grants. And that we have seen a pattern where a lot of the not-for-profits that help with grant writing tend to bring themselves to certain jurisdictions and not other jurisdictions. So we, in my impression, end up with jurisdictional inequity in competitive grant writing programs. And so I do have some concern that that money will end up where you have the most robust grant writers and the most robust not-for-profits that want to be with a particular jurisdiction, and we won't have geographical adequacy and access, and that there be some measurement of outcomes on the grant so that you can see whether or not the grants themselves are actually having any outcomes, and that the grants be a certain amount of time, because we run into this with children, youth, and family grants and everything like that. They come in, they apply for a grant, and then it's only allowed for a year. Then the grant doesn't get renewed. And so a lot of people are reluctant to come into certain jurisdictions. And so I just wanted to vocalize that I do have some concerns about relying so heavily on a grant process because some of the inherent weaknesses that come with that.
Just a few things we had heard when we're out and about, and with our Maryland Town Hall series, we've been to Western Maryland, the Eastern Shore. We had 2 of the town halls in Baltimore, as well as Anne Arundel County. We're going to do a few more coming up, and it's such a great environment where we can hear from the individuals in the community. And we have heard that grant writing is difficult. The last time that we heard it from a few nonprofits. So we did a webinar actually right before the grant process started, and we will continue to do that as well with this grant writing webinar. We've tried to really tailor it down so that it's easier to write, and also to give as many at the webinar, give pointers on how to write the grants. Also, when you were referring to the measurement, what grants are working, what grants aren't working, the OOCC continues to work with all our local jurisdictions, the OITs. We have great relationships with them, as well as our state partners. We have an OIT program inventory, which if anyone would like to see that, we can send that along. It has approximately 145 programs that are being implemented throughout the state. And it's my understanding that the state of Maryland, there may be 1 or 2 other states that are doing this, but it is a very thorough master list of all the different programs that could potentially be out there. And we ask that our OITs, when we're talking with them, and we ask that every quarter they update it, just for us to see what is going on in the individual communities. We're working with the OD2A team at the Maryland Department of Health and Johns Hopkins and University of Maryland to assess even greater with looking at the fatality data and looking at that master's list of what counties got and what municipalities have what in place. Is it making an impact? So we're diving into that right now, and we're really looking forward to getting that report back so that can help us in our strategic planning. As well as the dorm project, which again, we can send that report over to you, which I previously addressed. And that it's a very interesting report, and it's just going to get better. We just had it released, but more data sources are going to be added to it. And it really does show who is at risk for overdosing. I already mentioned the town hall series, just listening to see what is working, what's not working in all of the different jurisdictions. And I hope some of you can join some of our Maryland town halls. They're really informative to see what everyone is saying in the different communities. And when we were doing our strategic plan from the get-go, we looked at CDC's 10 evidence-based programs that prevent overdose, and that was a primary consideration when we were drafting the original strategic plan.
Thank you, Madam Chair.
My pleasure. And thank you, Ms. Ricker, for answering. Any other questions for Ms. Ricker? Ms. Ricker, is your team testifying or is it just you?
It was just me. If there was some specific questions, I had them here, and I appreciate you.
I have a general question, if I may, and I always like our members to go first before we do, and I don't see any other questions. So if I may, are you able to provide to both committees a list of the grants that you have in general, right, awarded, and by jurisdiction? Can you give us the amounts by jurisdiction, please? There are 23
absolutely.
counties and Baltimore City. I would say if you could give it to us like for the last 5 years or something, just give us a list of where that money has gone. I think it goes to the concerns of Ms. Valentino Smith and others, just to make sure that, that it's going where it's needed. I'm sure it is. It'll be great.
Very much. Yes, absolutely. They are in all of our reports, but so that you don't have to read all the reports, we will have it very documented, easy reading for everyone to see all the past grants.
Thank you. And the report that was given to you, or the task force on the disparities, health disparities, are there any recommendations that stand out to you?
The report is due to the Lieutenant Governor, I believe in July. So as soon as we get that information, our Deputy Director, Marianne Gibson, works closely with Dr. Aaliyah Jones and Dr. Noel Braithwaite on the Racial Disparities Task Force. But that they're still in the works. And as soon as we get that, as soon as we get those recommendations, we will absolutely provide that and
for the 2023 session.
Yes, and we'll be incorporating that into our strategic plan as to where the money would be spent. Absolutely.
Sounds wonderful. Thank you for your work and for giving us the time today. I don't see any other questions, so I believe this will conclude this joint presentation. I want to thank everyone for coming. I don't know if my chairman, co-chair would like to say a few words, but I personally like to thank everyone for your time and your efforts. We appreciate it. Mr. Chairman.
I want to thank everybody for joining us today. I want to thank the presenters. It was incredibly informative, not informal. And hopefully everyone, now that we are done, can get back to shoveling their driveways. Good luck, everybody.
Thank you. Have a good day.
Stay safe and warm, okay? Thanks for everything.
Bye-bye.